Low-grade fever, lasting more than 3 weeks. When antibiotics are a clinical mistake, prolonged low-grade fever doesn't mean bacterial infection, and empirical antibiotics are not the answer. The most effective bedside tool is point-of-care CRP testing. The threshold is clear. CRP below 40 milligrams per liter allows you to safely withhold antibiotics without worsening outcomes. This single step has been proven to reduce unnecessary prescriptions significantly. Combine CRP with a structured clinical algorithm and clear patient communication. This approach reliably reduces antibiotic overuse, especially in children and adolescents, without compromising recovery. Host protein tests show promise in distinguishing viral from bacterial infection, but still require validation before routine use. The rule for tomorrow: prolonged low-grade fever plus CRP below 40 milligrams per liter equals no antibiotics. Stop treating the number on the thermometer. Start treating the evidence.